Dengue or dengue fever. Today we'll be talking about that. How do you detect, manage in 2015 November? This is the presentation is based on the current best evidence. What should people worry? What should doctors worry about? What should patients worry about? And what's the management? Now, basically it's a self-limiting fever. In 90% of the cases, it is self-limiting in 2 to 7 days. They can have the following symptoms of headache, eye pain, myalgia in 80% of the cases, rash in 50%, nausea and vomiting in 50%, and diarrhea in 30% of the cases. Cough, sore throat and nasal congestion in 33%, and hemorrhage sometimes. Stages of severity: initially it will begin with undifferentiated fever and it might resolve with that, but some patients might get hemorrhagic fever or hypovolemic shock or dengue shock syndrome. Tourniquet test, which we'll talk about soon, is for early diagnosis of the hemorrhagic dengue. After 2 to 3 days of the patient might be afebrile, but critical phase with the risk of hemorrhage and shock occurs in some individuals. Epidemiological determinants: first infection sensitizes the patient, while the second produces immunological catastrophe. It is caused by the mosquito Aedes aegypti. It basically bites during the daytime and it's a fearless biter. It breeds in static water around the houses. So that's what we need to educate the patients to take care of the static water around the house. High-risk patients, right from infants and elderly, obesity, pregnancy, peptic ulcer disease, DUB, hemolytic disease, congenital heart disease, diabetes, hypertension, the whole range, basically chronically ill patients. Question: what diagnostic tests should we do? The clinically important test which we could be doing is the complete blood count, especially the platelet count and hematocrit are closely monitored to find out if the patient is going to develop bleeding or not. What is not done routinely is viral antigen detection by ELISA and dot blot assays, but these days it's become popular fashion. People have the money and they get it done, but it's not required. Rapid diagnostic tests, they are still in the research phase. Danger signs: what should we be worried about as clinicians? The rise in pulse of more than 20, fall in blood pressure of 20 millimeters of mercury, the difference between systolic and diastolic blood pressure less than 20 millimeters of mercury. If there are more than 20 hemorrhagic spots in the tourniquet test per 2.5 centimeters square, and the platelet count is 20,000. Often we see that the platelet count has decreased from 140 to 90, etc. So these have to be followed up serially. What is the tourniquet test? I'll dwell more on this because this is a clinically important test. Inflate a blood pressure cuff to a point midway between systolic and diastolic pressure and keep it so for 5 minutes. Positive when 10 or more petechiae per 2.5 centimeters square. In dengue, hemorrhagic fever, definitive positive results, that is more than 20 petechiae, is considered as indicative of hemorrhagic fever. It may also be positive or negative during the phase of profound shock. Treatment: plenty of oral fluids, rest, pharmacological, oral rehydration supplement, paracetamol can be given maybe 4 to 6 hourly. There's no role of antibiotics. More important is do not give aspirin or non-steroidal anti-inflammatories. The danger signs, if they occur, which we have mentioned earlier, the blood pressure differences, etc., need immediate hospitalization, because there they will give IV fluids if there's persistent vomiting, and IV fluid before capillary leakage is not recommended. So don't jump the gun to admit the patients. Patient education: what do we tell our patients? Maybe we should be having handouts in the clinics and giving it to the patient so that they do not bother us in the middle of the night. Complete bed rest. Control of fever is important. Take regular paracetamol every 6 hours. If fever not settling, do tepid sponging, but avoid Brufen, Combiflam or aspirin or Disprin. Hydration is key for recovery, so take plenty of oral fluids, 3 to 4 liters per day. Prevent spread of infection by using appropriate clothing, repellent creams, bed nets. Avoid water stagnation both inside and outside your home. What should patients watch out for? Severe abdominal pain, vomiting, bleeding from the nose or gums, blood in stools, black tarry stools, in females heavy periods, red patches or rashes on the skin, shortness of breath. In case of above symptoms, ask them to contact the doctor immediately. Thank you.